Good evening, friends. Today I'll be discussing about how to manage a calcified canal. So often students have come to me and asked me, ma'am, how do we go about managing a calcified canal? So today I'll be discussing few steps and few important points you can keep in mind so that you're able to easily manage a calcified canal. So first of all, the first important point is that you should have enough time. Plenty of time is required when you're going to treat a calcified canal, because it is not going to be easy and you will have to have a lot of patience and time to deal with the canal and the patient. Okay, so first of all, whenever you have plenty of time, keep an appointment that way so that other patients, you are not keeping a lot of patience and you have time for yourself to concentrate and locate the canal. Second important point is, to locate the canal, you will require magnification. So in case of magnification, you can have either loupes or you can go about under a dental operating microscope. So that will enhance your vision and it will be easy for you to locate the canal. Now once you have located the canal, then the third thing is exploration of the canal. How do you go about doing or locating the canal and going inside, deep inside, and maintaining the patency of that canal? So what you have to do is, first we'll be starting with small size pre-curved. The instrument has to be pre-curved. The files, the stainless steel files, small number files you have to use. 6, 8, 10 numbers are the small number files, and they should be stainless steel files and they have to be pre-curved. You have to curve the tip of the file. Okay, once you have curved, you should make sure there is no kink in the file, otherwise the file will fracture. So they should not be bent more than 45 degrees. Okay, never at 90 degrees, otherwise the kink will be there and they'll fracture. So you give a pre-curve to the file and you start locating and going deeper into the canal. Now these stainless steel files, they have a tendency to unwind and fracture. So we have certain files which have come into the market like the C+ file, C pilot files. Now what is the difference between a C+ and a C pilot file? A C pilot file does not have an active cutting tip, whereas a C+ file has an active cutting tip. So in case you have an active cutting tip, you can perforate, right? So if you have located the canal orifice properly, then you can go ahead with the C+ files, else a C pilot file will help. Okay, these are rigid stainless steel files. They are very rigid, so they will not unwind. They are stiffer files because they are heat treated. Okay, there is special treatment given to these files. Now once you have located the canal, you have worked with the small stainless steel files in a watch winding motion. Then comes the next files, which are your flexible NiTi files. Okay, so these NiTi files, you have ESX Explorer, you have ESX Scout file, the Explorer file, you have this Wave 1 Gold, we have a path file which is there. So these files can be used to maintain the glide path. So glide path is basically you are making a path for the rotary files to come and go and slide inside the canal smoothly. So you will be using small pre-curved stainless steel files. Then you come to the NiTi files, which are smaller size and flexible files. Okay, once you have done this and the glide path has been created, you will go about with the rotary files. Now rotary files, which are the rotary files which are good for your calcified canals? These files should be heat treated so that they are stiffer, they are flexible, and they'll not fracture. Okay, they'll have more cyclic resistance, cyclic fatigue resistance. So you should have heat treated files. You can have M-wire or R-phase based files. So these files will definitely have more cyclic fatigue resistance, more resistance to fracture, and therefore you can easily use them in calcified canals. Another important thing to be kept into mind while working on a calcified canal is that the canal should never be dry. Okay, you have to keep lubricating the canal with EDTA gel, and you have to simultaneously use hypochlorite also, so that you have a wet canal. Once the canal is dried and you have a calcified canal, the chances for instrument fracture increases. Okay, so you have to keep in mind that the canal should not be dry, it should be wet all the time, and you should keep irrigating, keep lubricating the canal very often. So these are some important points you should keep in mind so that you are able to treat a calcified canal well. I hope this video will help you to negotiate and to treat well a calcified canal. Thank you.